Essentially, blood pressure, what it measures is the force that the blood exerts on the walls of the arteries. So essentially, there's two measurements that are measured. There's a systolic blood pressure. It's when the heart contracts, that it pushes blood through the arteries and it exerts a certain force. That's called the systolic blood pressure. And then as the heart relaxes, that blood's still flowing through the arteries and it's still exerting a blood pressure called the diastolic blood pressure. So I commonly refer to it as the upper number and the bottom number. Systolic blood pressure being the upper number, diastolic pressure being the bottom number, and both numbers matter from a clinical standpoint. We commonly use it to assess someone's risk of having heart disease, and then we use them as targets of treatment. We want those measurements to be close to normal as much as possible. My name is Dr. Mahmoud Al Rifai. I'm a cardiologist at Houston Methodist. A normal blood pressure is commonly defined as less than 120 over 80. Anything that's above 120 to 130 or 80 to 89 is commonly defined as elevated. And then anything more than 130 over 80 is defined as having high blood pressure, or in other words, hypertension. And there's a couple stages, 130 to 140 and 80 to 89 stage 1, and then 140 to 190 and above is stage 2. And the higher the blood pressure categories, obviously correlates with higher risk of heart disease and stroke. So we want to bring down those numbers as close to 120 to 130 over 80 as possible. Ideally, you want to screen for high blood pressure in your early childhood, but then for adults, as of age 18, screenings should begin. Typically, when we talk about prevention and assessing someone's risk, commonly starts at age 40. Now, in someone who may have obesity or a strong family history of heart disease or an unhealthy lifestyle, screening should start early and frequently because blood pressure can change. In a few weeks, in a few months, someone who was labeled once as normal can be labeled as hypertensive. There's also the issue of blood pressure measurement. You may have completely normal measurements in the office, but high blood pressure at home, and vice versa. So having a blood pressure cuff at home, I think, is also super helpful for the clinician because blood pressure changes over the course of the day depending on multiple factors. Multiple measurements of blood pressure are important to identify people at high risk and identify those who may have masked hypertension, so normal blood pressure in the office but high blood pressure at home, or white coat hypertension where they have high blood pressure in the office but normal blood pressure at home. We can do many things, lifestyle changes that can lower blood pressure naturally. Biggest one would be weight loss. So decreasing weight, whether it's with medication or bariatric surgery or just decreasing food intake. Weight loss is helpful. Cutting down on salt intake. We commonly will recommend no more than two grams of salt per day. Now, multiple sources can define that threshold differently, but the point being is you want to minimize added salt intake to your diet. And that also involves junk food, processed food, because those commonly have a lot of salt in them. Decreasing stress. Stress can raise blood pressure, getting good sleep, and then also some patients may have undiagnosed obstructive sleep apnea, which means that there are episodes when they're sleeping that they have some kind of obstruction to their airway, and so that, if it's not diagnosed and treated, can actually contribute to high blood pressure too. So those are some things that are non-medicinal that can lower blood pressure naturally. Blood pressure can be, if it's not super elevated, more than 200 over 100, most patients will not feel symptoms. But when it gets dangerously high, some patients may experience headache. They can have some symptoms that may mimic a stroke. Chest pain can also happen. High blood pressure can also lead to what's called flash pulmonary edema, and in the extreme cases where patients become short of breath, requiring medical attention. But most of the symptoms that patients will complain about or tell us about is headache. That should raise concern for high blood pressure.